was reading on a forum an anonymous question. I think someone was mentioning, a dentist was mentioning that they were driving their kids to school and their kids were asking them, what do you do? Like, what do you do every day at work? And their answer like, I fix people's teeth. And then after that, it hits them that, that's my purpose, just fixing teeth and getting paid to pay mortgage and pay for school fees. And it seems like they were like venting out. That made them really sad, made them very anxious. And in general, they're very anxious about dentistry. And I felt really sorry for the dentist because I know how this feels. Sometimes you go through these phases. But I want to talk to you today mainly about the question, if you ask yourself, what do you do for a living, or what do you do at work, or someone asks you, how do you respond to people? How do you talk to yourself, and how you can change your mindset as well? First, for credibility, my name is Khaled. I have been a dentist for 20 years. I own my dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. And I took it from 1 chair to 10 chairs, from 3 staff members to 40 staff members over the course of 14 years. And you can check my details below for credibility. It's tracking back to this anonymous problem or anonymous post. I don't think this is just the last straw. I think there is a lot of other factors that make them dissatisfied about dentistry. It could be as simple as a lot of things going on in their lives. There is a lot of anxiety about the profession itself, high expectations since childhood from parents. I have another video on mental health and dentistry. Please watch it. I explain this more in details in like 10 minutes. My journey with mental health when it came to dentistry, and how I hit something similar, and how I seek some help and from a really good clinical psychologist, and understood what the meaning of oxytocin, serotonin, and endorphins, all the happiness hormones, and dopamine, and cheap dopamine hits, and cortisol and other stress hormones, and the difference between them, and how can you in your life slowly, even in dentistry, increase those happy hormones and decrease the stress hormones. But anyway, I have another video that I can share this. I share this in details, and maybe I'll do another video about those hormones in particular as well. Now back to how do you talk to yourself about your profession is very important, and how do you talk to people about the profession is very important. If you are a dentist who just do basic general dentistry, so fillings, extractions, emergencies, scale and clean, and you feel like you're very disconnected from the profession, so you feel like it's just a job, I'm just taking teeth out and putting some filling, getting paid, and going home. You feel miserable about your dentistry. It's okay to feel this way initially, but you need to work on that because it's a long profession. You can't keep going like that for the next 20 or 30 years. Eventually, you're just gonna be one of those dentists who start to not care about patients, not care about teeth, and just do minimal efforts, and your dentistry will start to decline. So you need to really go back and explore why you are thinking this way. Is the workplace is off-putting? Is dentistry, certain aspect of dentistry is off-putting? Is there the way your nurse suction is, the way your appointment book is organized, the way your day are organized? Is yours a lot of pressures in your life in general as well? But if that's where you are in dentistry and that's how you talk to yourself about it, you need to change this mindset. You need to change the environment around you. So let's say you're doing general dentistry, but you're okay with it in a way. Instead of talk to yourself in a way, my job is to fix teeth and get paid. Maybe your job is I get patients out of pain. So you talk to yourself in a way, what do I do every day at work? People come to me with problems, pain, and I get them out of pain so they can have an enjoyable life. So they can go out, have lunch and dinner, enjoy their life without having pain. If you're in an emergency, then it's nothing wrong with that. But instead of saying, I just fix teeth and get paid, I get people out of pain and I get paid. Someone asks you in the street, oh, what do you do for a living? People come to me in pain and I get them out of pain. So you need to start talking to yourself and to people like that all the time, and repeat it over and over until you slowly change your mindset. Of course, besides fixing a lot of things that I covered in another video in your life, in your psychology in general. It could be a dentist who is involved in airway. What do you do for a living? I help people sleep at night. That should be your mentality and how you answer people. I don't like to answer people say I'm a dentist. It's so boring. Just try this. Try it once. Just try it once. Someone in an aeroplane and a plane next to you, or a random person, like, what do you do for a living? I'm a dentist. Like, oh, all right. Ugh, I'm scared of dentists. I don't like dentists. Usually get this answer maybe 9 out of 10. Or, all right, cool. They're just so bored. I like to play a little bit of a game, and that's how I also to talk to myself. People ask me, "What do you do for a living?" And you can be as cheeky as you want with it, but I simply, people come to me and usually, pay me some money so I can make them smile, or sometimes they cry a little bit, but then I make them smile at the end. Oh, who pays you to get to cry a little bit and make them smile? Or people come to me and I help them sleep at night so they can have a good relationship with their spouse. Well, what do you do? Are you like a sleep doctor or something? I just make them appliance to make them sleep or breathe better. So I don't just say I'm a dentist. But if you are a general dentist doing just general basic work and someone would ask me, I would say as well, what do you do for a living? People come to me in pain. They pay me so I can get them out of pain. And I really feel content because at the end of the day, that's my job. Every day people come to me with pain. They'll go out without pain and they have a much better life after that. I know we're not heart surgeons. I know we are not probably orthopedic surgeons or emergency room who saves lives, but I think our profession is still very important. Even if you're doing the basic general dentistry, if you're a hygienist, what do you do for a living? I would say, people come to me with with problems, and I fix these problems for them so they have a longer life. If you treat their perio or their gum health, they have longer lives for sure. That's based on science and studies and research. People come to me, they pay me so I can make them live longer. Oh, that's very exciting. How do you do that? Oh, well, by fixing their gums. If I fix their gums, their chance of getting heart disease will be a lot less, and other diseases will be a lot less, and they will have a longer life. So change your mindset about your profession. It's very, very important. Change your mindset, how you speak about your profession, or find a way to make it more enjoyable, or find a way to exit from it if you have to. That's your life. Design it how you want it to be. If you're going to do this for 30 years and you speak to yourself in a negative way, you're not going to survive a long time in this career, and you start to hate it even more. So practice what answer you want to give yourself. When someone asks you, what do you do for a living? Rehearse it many times so it becomes a second nature, and you also believe in it yourself. If you find this information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, and I will notify you when more videos are released. Thank you so much for listening to me. It means a lot to me.